Now let's discuss individual antipsychotics. Clozapine. It is a well-known 5-HT2A and D2 antagonist, also known as serotonin dopamine antagonist, and is considered to be the prototype of atypical antipsychotics. Although antipsychotics are generally dosed so that about 60% of D2 receptors are occupied, this may be lower for clozapine for unknown reasons. Clozapine causes very few, if any, extrapyramidal effects, not causes any tardive dyskinesia, and does not elevate prolactin, and is recognized as the gold standard for efficacy in SCIS. Patients treated with clozapine may occasionally experience an awakening, characterized by return to a near normal level of cognitive, interpersonal, and vocational functioning, and not just significant improvement in positive symptoms of psychosis. This is unfortunately very rare. It is also the only antipsychotic that has been documented to reduce the risk of suicide in SCIS. And clozapine may actually reduce tardive dyskinesia severity in some patients with this problem. But then, clozapine is also the antipsychotic associated with the greatest risk of developing a life-threatening and occasionally fatal complication called agranulocytosis in about 0.5 to 2% of patients. And thus, blood monitoring is needed for as long as clozapine is continued. It also has an increased risk of seizures, especially in high doses. Can be very sedating, can cause excessive salivation, and has an increased risk of myocarditis. And is also associated with the greatest degree of weight gain and possibly the greatest cardio-metabolic risk among all the antipsychotics. Thus, clozapine may have the greatest efficacy but also has the most side effects among the atypical antipsychotics. Interestingly, the cause of agranulocytosis, myocarditis, and seizures are entirely unknown. While weight gain may be associated with the blockade of both H1 and 5-HT2C receptors, sedation is probably linked to clozapine's potent antagonism of M1, H1, and alpha-1 adrenergic receptors. Profound muscarinic blockade can also cause excessive salivation, especially at higher doses, as well as severe constipation, even leading to bowel obstruction from paralytic ileus.